Hello, everyone. Thanks so much for being with us today. I'm Christy Kirkup. I'm a national health reporter for the Globe and Mail, and I'm pleased to be your host and moderator today. And I would like to welcome everyone in the room, of course, and those watching on live stream as well from all across the country to our event, Postpartum Depression, Supporting Mental Health for New Mothers and Families. And before we get started, I would like to acknowledge the land on which the Globe and Mail headquarters is situated, the traditional territory of the Wendat, the Anishinaabeg, the Haudenosaunee, the Métis Nation, and the Mississaugas of the Credit First Nation. And over the next hour, we're going to be discussing mental health challenges that mothers and gender diverse people face in the postpartum period, including depression, as well as some of the resources that are available to them and what more can be done to support them. And mental health disorders are among the most common conditions that occur during and after pregnancy. And as we'll hear today, Statistics Canada has reported that a quarter of persons who give birth reported symptoms that are consistent with postpartum depression or an anxiety disorder. Rates are also higher among those who are adolescents, persons of color, immigrants and refugees, individuals who live with disabilities and are gender diverse, those facing financial or domestic violence, and those who have experienced mental health challenges in the past. And this also applies to individuals who have little to no family support. And as a mother of two, I can acutely appreciate the tenderness of this time of life in the postpartum period. And it's also something that comes up frequently when I report on women's health issues, which is one of my central beats here at the Globe and Mail. So today's event is sponsored by Biogen. Please note that all the speakers that will be appearing today are doing so independently. And if you are joining us in person today, I would like to invite you to stay for some refreshments and networking after this discussion. And if you have questions during today's talk, please save them or submit them in the Q&A box. We'll answer as many as we can at the end during a question and answer segment. You may also find some aspects of this conversation could be quite sensitive given the topic that we're going to be talking about today. So please, we want to note that if you need at any point a moment to step away, please feel free to do so and to take good care during and after today's conversation. And with that, it is my pleasure to introduce our fantastic panelists. So first, we have Farah Jivraj, the Head of Market Access, Policy and Stakeholder Relations at Biogen Canada. We have Dr. Achana Vidyasinkar, who is a perinatal psychiatrist as well as a clinical assistant professor at Memorial University and the director of the Prakash Pathways and Psychiatry. We also have Maya Kurana, Associate Vice President of Healthcare Strategy and Corporate Development at Manulife, and Melissa Gallagher, the co-founder and CEO of Almacare. So welcome, everyone. Thank you for being here. Let's jump in. Thank you so much. So I think we'll start off today's conversation by perhaps, Doctor, I might turn it to you to give a bit of, just to kind of go over the definition, if you will, of postpartum depression, and perhaps also touch on postpartum anxiety or even postpartum psychosis, which we also sometimes hear about.
Absolutely. Let's talk about what postpartum depression actually is. When we talk about the definition around postpartum depression, it's mostly made up of the following, and that's a loss of interest, not wanting to do things, not wanting to engage, energy changes, concentration changes, your interactions with your loved ones change, your mood is just low, it's sad, it's something like you've never felt before. And this is such a critical emotional change for so many women and so many birthing persons that really interfere with their day-to-day function. And you can have symptoms of depression, but when it becomes a disorder, a dysfunction, it really interferes with wanting to get out of the house, wanting to talk to your loved ones, wanting to engage with your child. I had, for example, someone with depression who sat on one end of the couch and shoulder, baby on the other, in the carrier, and just looking away. And there was something so significantly profound about the change in their emotional state. So when we talk about depression, there can be symptoms, but there can also be this severe disorder that is so life-changing. It can often come with anxious features too. So this worry, this, are they okay? I need to check on them so many times. It's, waking them up from sleep to make sure their baby's okay, feeling overwhelmed, irritated with loved ones. So it can be a complicated cluster of symptoms, but a really big change from their day-to-day state before having baby. And this can start in pregnancy too. Right, and I think we need to be aware that 40% of postpartum can actually start in pregnancy. So it's looking for some of these symptoms along the way on their journey, and how it's playing a role in people's lives. So a depressive episode can be incredibly impactful.
One thing, just as a follow-up, if I may, and maybe this is hearkening back to some of, after I had both of my daughters, you might have quite a sleepless night, and of course, sleep deprivation really does tie into mood. How would someone know, perhaps, that, it goes beyond, oh, I just had a rough night, or I'm feeling kind of down because of that, to kicking into being postpartum depression?
It's a really good question. And when we meet with a lot of parents, it's trying to figure out, is it sleep deprivation? Is this the blues or the pinks that can happen in those first few weeks after delivery? Is this more anxious features? Is this more of a depressive episode? Is this something like they've ever had before? It's when it starts to be prolonged. We're looking at maybe more than 2 weeks, with or without sleep. And so it's looking at the bigger picture of it and the impact, because you can have those sleepless nights, but is it starting to wear down? Is it starting to create low mood changes, no interest, this guilt, this emotional shift and change? And it's those check-ins with your loved ones and your healthcare providers that can often, because you may not realize it, and then that's one of the hardest parts, is you might just be going through that sleep-deprived state every day, but it's maybe the ones around you that are saying, well, you're not really responding to those texts anymore. You're not, kind of interested in a conversation, or you're not eating as much as you used to. And it's when you start to notice those daily changes in your lifestyle that it starts to be something real.
Thanks, doctor. And so maybe just to expand it a bit then, how big of a concern is postpartum depression? Maybe, Melissa, I'll get you to jump in.
Yeah, I would say it's a great concern. And to Doctor's point, 40% of cases start before pregnancy. And at Alma Care, we start working with families typically during their pregnancy to begin planning for postpartum, and putting the resources in place, and more importantly, the infrastructure to be able to support and proactively approach this part of their journey. And in doing so, we've learned that 70% of families that we work with who are heading into postpartum or preparing for birth are saying that they feel at least anxious, all the way up to completely overwhelmed. So we do a check-in, during their pregnancy, and we can see that this is a significant percentage of the population who's feeling this way, and that could have to do with anxieties around labor and birth itself. It could have to do with what's going on in their relationship or their economic stress. All of these very normal things that attribute to depression, and then are exacerbated because of the sleep deprivation. It's very normal to not have more than 2 hours of sleep when you have an infant at home for the first couple of months in any given stretch. You should have more than that, definitely, but in any given stretch, 2 hours at a time. But it's when you you aren't able to sleep in those windows that is really concerning. And I think that, in our experience, because we do work with families through the postpartum journey, it is a significant concern for the outcomes for these families, both in those, what we would typically look at as the postpartum period, but then well beyond, and the ripple effect that it has on their ability to function at work, return to work, have a happy and successful relationship, build a bond with their baby. So I would say even the 1 in 4 women experiencing postpartum depression is severely underreported, and that anxiety is far more prevalent than anyone really realizes or admits, and that it is a significant issue because it's not addressed proactively, and it's treated more as like crisis management.
And in terms of the big scale of this, as Melissa's saying, it's about the families, and the impact on paternal mental health, on infant mental health. We talk about child and adolescent mental health. Well, they start as babies, and that fetal programming starts in utero. So there are so many opportunities that we can take to intervene. This is sometimes the first time a birthing person is interacting with the healthcare field, right? So it's such a critical period that can impact the whole family and intergenerational impact as well.
And just to add as well, I mean, we've looked at the costs of postpartum depression, and if left untreated, this can be staggering. In Canada, postpartum depression can cost up to $6.2 billion, both indirect and direct costs,
Wow.
including things like lost productivity, absenteeism, healthcare resources, and the long-term impacts, as you were saying, on the family, the baby, the spouse, etc. So, these costs are staggering.
Wow. Maya, and what about from an insurance perspective? What are you seeing?
I was just about to add to that. We see in our data that 15% of new moms claim for mental health support within the first 6 weeks of having the baby.
Wow.
And 42% of them are claiming for mental health support for the first time ever.
Wow.
So half of these individuals have never experienced or sought care for mental health, and this could be their first encounter, let alone individuals that are prone to mental health challenges, and then going into motherhood. On top of that, you can just think about how much more exponential it can get.
Wow.
And if I just think about the statistic, 1 in 4 women are reported to have some sort of an anxiety related to postpartum, and only 15% are claiming it. So there's a big gap in this becoming common knowledge for it to be something that everyone is aware of. I think we have a gap there, and then we need to make sure that we have the right systems in place so women feel comfortable reaching out and claiming benefits, because a lot of people don't know what they have available as well. So a lot more work to do there.
I believe also there was a statistic from Sun Life Canada that stated that they're seeing many, many more claims for disability as well. Yeah. And in fact, there are more disability claims by women than men. And of course, we all know disability claims cost a significant amount to insurers and employers.
Let's touch upon maybe some of the risk factors for postpartum depression. What are some of the factors perhaps during one's pregnancy where perhaps those conversations should be starting during pregnancy, what they should be watching out for? Melissa, I'm wondering if you think that should be happening well before the birth.
Yeah, absolutely. It's part of the conversations that we're having with families as they're preparing for the 4th trimester. Is around, mental health screening. And do you have any pre-existing conditions that, may be exacerbated by the lack of sleep or the, physical trauma that you're going to, be experiencing via childbirth, even the most uncomplicated childbirth. So, we're having those questions and we're trying to identify anything that's pre-existing, any financial stress that the family is under, having access to family. You mentioned it, Christy, many of the families that we work with at Almacare are first-generation Canadians and don't have access to their family members to support them or build that community with the hands-on support that they really need after giving birth, that culturally and historically, this is how birthing people were supported, was with their family members, and many of them don't have access to that. So there's a few, those are, certainly a few that we see and can identify that was going to put a tremendous amount of stress and likely put that person at higher risk of postpartum depression.
And how about, doctor, are there other factors that perhaps you would be watching out for?
Yeah, so, when we have conversations with folks, it's about, really creating a biopsychosocial approach to the individual, right? Where are they coming from? What is their biology, their genetics? What can change in terms of epigenetics, which is really fascinating research actually in the area of postpartum depression. So, do they have a family history? Did their parent, did their mother experience, hormonal changes during their menopause years? Do they themselves have hormonal features during their premenstrual phases, right? So there's this biology about the person that, really should be considered when it comes to who is in front of you. Then we have the psychological or the psychosocial as well, and what has their experience been with counseling, with therapy? Have they are they psychologically minded as well in terms of the different kind of supports that are out there? Socially, what's happening, right? What is and that's such an important conversation in this day and age about what's happening in the family network, what's happening in their cities, in their towns, in their neighborhoods, that can create environments that can be either really supportive or really scary. And in terms of intimate partner violence, relationships, what are they like with their partner side of the family, their own side of the family? What is their village? What is their community? So it's really looking at that whole approach, and that helps also kind of put together that plan of what they might need later on as well. But it's complicated. It's not just one thing. And I think that's really important. A lot of parents and birthing people will put pressure on themselves. Well, I didn't do this one thing, and that guilt, right? In terms of a symptom of depression, that guilt can be so heavy. I didn't do this, I took this, I ate sushi, it's a lot of load. There's a lot of information that comes at you when you're in this parenting journey. And so, it's never just one thing. It is complicated, but it's that long-term picture of it. It's seeing the person as a whole. That can be risk factors. Have they, as Melissa was saying, experienced mental health issues before? Have they had a postpartum depression before? That is a risk factor as well. Have they been more anxious? Are they on medications? Has it been managed? So lots of parts to the story. Lots of risk factors, lots of mitigating factors too.
I think also another risk factor is really timely access to care. And Statistics Canada just came out with a statistic around, 20% of women who have mental health challenges have not been able to access treatment. And even when we look at, the patient journey, do women know where to go to? Is it their GP? Is it their OBGYN? Who is asking them about their emotional well-being? I know as a mother whose son is now 20 years old, 20 years ago, nobody asked me about my emotional well-being. And still today, after 20 years, women are out there saying, nobody's asking me this question. So I think that timely access to care is such a critical component. And where can they find that care?
And to your point, it's the risk factors of the other side, right? We have risk factors that aren't asking the questions, right? Of these interactions with providers, with their potential healthcare team or community teams that may not be skilled, may not be trained. That's a risk factor too, because then if they ask, they might not know where to go. There might not be services. So there's risks in the community.
Yeah, I was just going to pick up on that. Again, just drawing from some personal experience here, I remember when I had my first daughter and I was being told, which again was something that I learned in that moment, that for the first year that one can be at risk for developing postpartum depression, and was essentially told to be on the lookout. But I don't recall there being a conversation. We did talk risk factors, but then it's like, and then what, right? If you're feeling these things, what tools are available to people? So I perhaps wanted to focus in a bit on that. What exists today in terms of some of the resources for people to be able to be supported in these difficult moments?
Yeah, I can get us started. So when we think about, we're quite lucky in Canada to have good parental leave policy. We lead in duration in the world, which is great. but duration doesn't actually equal support and positive outcomes. And I think that's where we do have a big gap, given the pressures in the public system. There's a lot more to be done there. Most people that have benefits through their employers will have access to things like employee and family assistance programs. You will have paramedical coverage that you can use for mental health support. But again, most of these support systems today are quite basic, reactive, short in duration, and not specialized to deal with the complexity that comes with postpartum. So we have a long way to go to make some improvements there. And what we're doing today is basic and not good enough, frankly.
I'll just add to that as well, because I think it's tactical, and we're talking about mental health, but when you give birth and after welcoming a child to your home, it becomes very tactical. The support that you need is hands-on. You need to sleep. That needs to be your number one priority, is getting sleep. And that requires tactical assistance. You need someone else to be watching the baby. You need someone else to be diapering the baby. You need that tactical support and that infrastructure. And those are resources that don't exist. And to your point, I think that there are some employers who, are providing. There's benefits providers like Care at Fertility who are just, paving the way in terms of supporting their employees. With 6 weeks of dedicated 16 hours a day, hands-on support in the home for mom and baby, or birthing parent and baby. And that's incredible. Like that right there, that strong support we see, there are statistics that when strong support is provided for the fourth trimester, that person is 60% less likely to experience postpartum depression. So that hands-on tactical support must be received, whether you have, access to resources to outsource it and hire someone to come in, or whether it's you sitting down with your partner and getting really tactical before baby arrives to say, this is the division of labor across the household, this is what I need you to do, this is how we are going to provide, to prioritize sleep. And it has to be both of you prioritizing sleep, because we touched upon, the father's mental health as well, but the partner can also experience postpartum depression. And it's really important that you do it together and that you make a very tactical plan to support that heading into, before baby arrives.
Yeah, and just to give you an example, so we serve just over 5 million Canadians in our group benefits business, including members and dependents, and 62% of them have paramedical coverage for under $500. Which is basically maybe 3 sessions with a mental health specialist. And if anyone has gone through mental health support, it takes 3 just to find the right therapist, right? So the basics is not good enough, and we recognize that as a gap in our product shelf, which is why we partner with Maven Clinic to really create programs that are specialized, longitudinal, and really do pull in support from a bunch of different spaces in the comfort of your own home. When it's 2 a.m. and your baby is not latching and you need support from a lactation consultant, it's available for you at your fingertips. So the access piece is critical. The next frontier of health benefits really needs to focus on providing specialized, longitudinal, and timely care to women going through this. 1 to 2 random appointments and a referral list is not good enough.
As you're speaking, Maya, you're painting the picture of, 2 a.m. with the baby, and perhaps that's a good opportunity to maybe also talk about social media. I'm just curious how social media may be playing a role in affecting a birthing person's mental health. Certainly I can attest to spending many, many hours in the dark breastfeeding when no one else is awake. You find yourself, you're alone and you have access to your phone, and I'm curious if perhaps we're seeing evidence that that's maybe increasing the amount of pressure or anxiety that people might be experiencing.
Huge. Let's be real. Social media can be such a valuable tool, but also such a just rabbit hole of algorithms and messages around bounce back culture, about, certain types of feeding and windows and latching and all sorts of probably, I don't even know, right? It could go on forever, and it's so influential. Like, everybody has access to media now. I mean, if you are able to kind of have internet access access is another thing that we have to talk about in Canada too, but social media, birth expectations. There's some research around birth expectations and what to go in expecting around birth and how people come out and the reflections of that and the traumatic birth experience, stressful birth experience. We don't talk about that at all, and about 34% of women experience stressful or traumatic births, right?
Yeah, the whole idea of a birth plan, I was like, who made it seem like I had any autonomy in what, really, you can go in with a plan, but then you just have to pivot based on the situation at hand.
Yeah.
So I feel like that language even, birth plan. How about birth goals? I don't know, it might go that way, but it might not. Certainly, a baby going to, my second went to the NICU. That was not part of my birth plan, right? So I'm curious if, even in the prep, to kind of maybe look at the language around, how you speak to patients about, what to expect in the way of their birth or...
Absolutely. We talk about birth goals, right? To your point, a plan is so finite, right? And when you walk in from a healthcare perspective and there's a 3-page plan that someone's kind of demanding or expecting as well, so you're trying to look at it from both user and provider. But, having those conversations, especially when, there can be a lot of anxiety around birth and experiences, tocophobia, about this fear of childbirth as well. And so it's having those conversations about what is in your control, right? We talk about that a lot, and what is not in your control, and having realistic expectations or goals, and who can you bring in, right? Who is your support network? Are there, doulas available or midwives? Who is in your birth care team that can help support you psychologically? Social media can be beneficial, and I don't think we should, completely write it off, but it's all about the algorithm. Right, and you can start to change it. There's some really positive messages out there. There's a lot of advocacy around women's mental health and perinatal mental health. But if you're liking the certain things, it's going to go in a certain way.
Yeah. Just to add, we've all heard the saying, right? It takes a village to bring up a baby. I think there is also a positive aspect to social media. Women do need that support group, that community, that sense of, not that isolation, I'm the only one feeling it, but that there are other women that are going through the same issue or birthing parents. So I think there is a way that we can actually look at the positive aspects of how to support, birthing parents that are in this situation.
And then to that end, I'm wondering if maybe we can expand out the conversation to talk about the role of society and stakeholders to better address postpartum depression. Maya, I don't know if you wanted to perhaps start.
Sure, I can talk about our role here and working closely with employers. This is, since we launched Maven, we've been working with HR leaders to make sure that we're making a case for including these benefits in your standard package across the block. We have some work to do there to get HR leaders on board. HR leaders can play such a critical role here because all the data shows, to your point, the postpartum period is the most predictable transition. And if it's well supported, you can really reduce attrition, improve your retention, keep your employees happy, and it's actually very expensive and time-consuming to replace mid-career women. So we're working with HR leaders to make sure that they're expanding access to support services for women. This isn't just about well-being, this is about workforce sustainability. And we are facing talent shortages in Canada across a range of industries. And, we've done a great job of getting women in leadership positions. The question now is, are we doing enough to keep them there? So that's really where we're focused in making sure that we're doing our best. We turned on Maven for Manulife employees just 7 weeks ago, and we've had more than 3,000 enrollments. And an OBGYN was a top consulted provider. It just goes to show that people are needing support. They're craving a place to go where they can get unbiased, well thought through information and speak to the right type of individuals that can support their care journey. So the pent up demand is there, and we're working daily with our HR leaders to make sure that we make access available across the board.
This is a bit of a mechanical question, but how does that work if someone were to be under Manulife, for example? How would they go about setting up the supports that you just mentioned?
So your HR leaders have to make that available for you, and then you can just access that actually in the Manulife app itself, where you use to submit your claims. We've done a single sign-on with Maven, so you can just click right to get care and get into their ecosystem and book an appointment, get enrolled in different programs depending on what's available in your benefits package. But we're trying to keep that experience as seamless as possible so people don't have to go to another ecosystem and that's disconnected from your claims, because you'd like to have all the information in one place so it's easy for you to use. But that's how we're making it happen tactically.
Okay, great.
And it's great to see the leadership that Manulife has shown on the whole maternal mental health space. I think to your point around, stakeholders, I think it has to be a collaborative approach. There's a statistics that says that 95% of physicians don't believe that there are enough resources in this perinatal postpartum period. Over 50% of them are saying that they've never had any specialized training. So, I think that there is a need for that more specialized training when we look at it from a physician perspective. When we look at employers, the awareness and the need to be able to have a safe space to talk about postpartum depression, right? Conversations like this get rid of the stigma that is still associated with postpartum depression. Governments, do they have a role to play here? Recently, last year, BC set out a policy on perinatal, postnatal policy to look at universal access, timely access, increasing awareness to make sure that there is a support for women that are and birthing parents that are going through this. So, is there a role for governments in other provinces to really put something forward? Quoting from the UK, NICE and even Australia has done a lot in terms of supporting this community in ensuring that postpartum depression is identified early and then putting those supports in place. And in fact, in Australia, they have reduced 50% emergency visits by women who are struggling with postpartum depression.
Wow. Their strategies there are really incredible. What Australia has done, what the UK has done in terms of advocacy. This isn't new, right? We talk about this as if this is a brand new diagnosis that no one's ever seen before. Oh my goodness. This isn't new. You talk to any birthing person, they will recall the story of how they gave birth, their fertility journey, their experience, that you will never forget. And we talk about it as if there's this new elephant in the room that we need to address all of a sudden, This has been around for generations, and, we're finally prioritizing women and birthing people and mental health all in the same category. How amazing. If this was men's mental health, if this was cardiology, if this was diabetes that was picked up during your pregnancy, you would have an immediate care plan. You would have immediate follow-up. This would never be dismissed. Everybody would be particularly trained and equipped and have pathways and resources. This is preventable. Right? This is a public health crisis that we don't talk about. We have so many silos of systems that have been talking about this, seeing it in front of their eyes for years, that aren't communicating. So there's a huge role in all the stakeholders to really come together and create infrastructure that works, that's supportive, that meets the needs not only of the person entering the system, but of the healthcare workers as well, that are supporting those individuals with training, with education. How many schools have talked about perinatal mental health in their training, to the pharmacists who are dispensing the medications, saying, are you breastfeeding? You know, this impacts so many individuals and so many groups and stakeholders. The family resource centers, oftentimes in rural Newfoundland as well, they're the first point of contact for a lot of families. Do they, feel comfortable having these conversations? Because mental health has been complicated. It has evolved. There is a lot more awareness and conversations around it. So again, this isn't new though, right? We just have to come up with a plan. I am grateful to say that in Newfoundland, Labrador, we do have a government task force that is starting to talk about putting that infrastructure into place that includes training and screening and education and pathways, because it is a systems approach.
Melissa, did you want to jump in?
Well, I think this is just such a relevant conversation. I really lean into, 40 years ago when my mom gave birth to her 4 kids, the system actually was in place. Like, she was in a multi-generational home. Her mom did live nearby. But more importantly, she was in hospital for a week after giving birth. So she was there for 7 days. And she had the lactation consultant visiting her with every feed. She had all of us sleeping in the nursery down the hall, being watched by the nurses so that she could rest. She had the nutrition being delivered to her bedside. So it actually was in place. And so much has changed over 40 years. Where now, fast forward to me giving birth to my first daughter, I'm nearing 40. My mom is older. She's not, she does a great job. She does a great job helping. But, most people, their parents are older, if you're so lucky as to have your parents around. So much has changed in those 40 years. And this is where I do feel that employers need to play a significant role, especially as women are taking on, real force in the workplace. You need to be able to support those women and birthing parents. And it's not just them, because it's also their partners. So their partners should also have access to these benefits as well, so that they can utilize them to support their entire family unit. Being able to access a certified postpartum doula, for 10 nights can make such an incredible impact, not just on, the birthing parent and of course the baby, but also the partner and their ability to go back to work and their, ability to be present at work, and reduce some of those other negative impacts that it can have. So this is where, from my perspective, I think there's so much that has changed over the past 40 years. I think we know all of these, resources need to be in place. We've seen them be in place, but a lot has changed. And this is where, we see, and I encourage employers to continue to play a really important role in supporting families.
One of the themes, obviously, that we've been talking about today is the role of stigma, and then obviously how things have evolved. And I'm wondering, why do you guys think that stigma remains about postpartum depression and the extent to which it remains?
I can say a trend that we see with Alma, and it kind of ties to what I've just mentioned, is that many families are having children later in life. So, and much of it is because, women are now playing these, important executive roles, and are focusing on their career before starting their family, or, and those high-functioning women are, at risk of postpartum depression. And I think they don't want to admit it. I was one of them. Like, you don't want to admit that you're at risk. You think, especially as a high-functioning person, you've planned it out, you know what to expect, the birth plan, all of the things, it's in place, you feel really good about it. And then as soon as things start not to feel right, the amount of time it takes to calibrate that in your brain is far beyond 6 weeks. For me, it was 9 months before I realized that it was, that I was experiencing postpartum burnout, anxiety, and probably nearing depression. That can that is, I think that's a trend that we see, and one that's prevalent.
What about the other panelists?
We still don't talk about it. And if we do, we talk about it in postpartum. There's still this language and this rhetoric that I'm worried about postpartum. I'm like, well, I'm worried about you right now. While you're sitting in front of me, while I know your partner is rotational and will be away for 2 weeks, and home for maybe 10 days if there's no storm. So I'm worried about your community, your village right now. Where do you have a lactation consultant in your town and in rural places? Do you have a family physician, right? And so if they don't have those safe places to talk about it or understand what it might mean now to kind of get that toolkit into place and to have those conversations, then when you're in it, it is hard. It is hard. It is overwhelming. You don't want to reach out. You want to get back in those covers, right? You don't want to engage, and so we put this pressure on the individual, but it's real. That guilt, that stigma. Well, I led this career. I've been wanting babies for, since I was a child. I knew I wanted to have children. I've been through all these fertility treatments. Of course I know what to do. And then it hits you and you don't know what to do. That sense of control is gone. So it's hard to admit. It really is. And then where do I go? And if I tell someone, what are they going to do about it, right? Where am I going to go? Do I have to see a psychiatrist? I'm not that scary, by the way. I like to, we're not all, super scary people, but, I might have to wait 3 years for a therapist, right? Through the system, like what's going to happen next? And so that fear, that worry, that impacts sleep so that you're not getting the rest that you need, drives that anxious and overwhelmed and burnout feeling of just trying to get through the days, So stigma and shame is still very real. Yeah.
It's really the gap between expectation and reality that you see a lot. It's when you have your baby, it's supposed to be like this. You're supposed to feel this immediate attachment. That doesn't really always happen. It takes some time. And I think much like everything else, we paint a very perfect picture of what everything is supposed to look like, and nobody wants to talk about those stories where it doesn't work out to be that way. So I think it's really the gap between expectation and reality. And your partners have a key role to play here. They need to know what to look for. They need to know how to reach out to you, how to have conversations on difficult topics. They need to be trained just as much as the woman or the person giving birth and recognizing their own challenges. Your partner has a key role to play here, and more work to be done there for sure.
Absolutely. When StatsCan did that survey in 2019, partners and family members are the first individuals people talk to. They don't go to their family physician or their OBGYN right away, is that they're talking to their loved one. So it's empowering those around you as well with the information, making sure that the prenatal classes are talking about not only, how to park at the hospital, but also your mental health during, during labor and delivery, where to go to pay your tickets.
Here.
So, it's empowering everyone, getting the information and knowledge, using social media, again, and the outlets out there, and really sharing the load of mental health during this perinatal period.
I would also add that, bringing it back to sort of when a birthing parent, a mother is going through this, how do they know where to go for care, right? And I think that is a big challenge. There was some statistics that showed that 40% of women that are suffering and have symptoms, they're just so busy trying to look after their baby, their family, that they don't even bother to try and seek out help. Or they just don't know where to go, and so they don't do it. Or alternatively, when they think about a psychiatrist, there's long wait times, you can't get an appointment, and so then they say, look, I'm just going to deal with it myself. And that's probably the worst thing that they can do.
Doctor, when you were talking about the toolkit, if you will, to get ready ahead of time, I know there's always a lot of discussion before you give birth about what's going to be in the bag when you go to, are you going to have, it's all about the bag until you realize that really, it's really not about the bag. Again, you think you have control because you brought some soap from home. But, is there again, it's not a physical bag, but like a kind of maybe a discussion or a roadmap that could be crafted before the birth occurs when it comes to an awareness of mental health and, again, maybe perhaps the available resources that should be tapped if need be?
Yeah, I think it's about recognizing, your journey through this whole process. What are your needs? We go through this a really great collection of things that we know that when impacted can really intensify mood and anxiety symptoms called NESTs. And that stands for nutrition, exercise, sleep, time for self, and your circle of supports. And this is so very important. None of those things talk about which medication you're going to take, right? This is about nutrition, exercise, sleep, time for yourself. These are the things that can really impact how you're feeling, which can sometimes lead to, just that point around kind of having good information around you, right, as to where to go and what is available. And that includes medications and therapy and resources, right? And having updated information as to what are the guidelines, what are the latest research around medications, what is safe, I don't like to use the S word, but what is something that you are able to take for your symptoms in pregnancy and postpartum from a medical perspective. But going back to those nest goals, I think it's really, really valuable. And I go through these with partners as well, or who they would like to bring into the conversation. And we go through nutrition, through hydration, we go through movement, or not exercise, not again, 6-week bounce back, let's get those abs back, right? But a movement kind of going for walks. Who are your stroller clubs around you, right? Who can you connect with on that movement piece, or if it's an at-home deep breathing, meditation, mindfulness, sleep. I think that's been the theme of the panel here.
There might be some lingering residue of lack of sleep. I can think about it for 2 seconds and have nightmares, but yeah.
Absolutely. Sleep is so important, and research tells us up to 4 hours of consolidated sleep, which we know you don't get. We know it's not how that starts, but how do we lead up to those 4 hours? Who can we bring in for support? When do we get those 4 hours? The NE, hold on, I'm getting there, sleep. T, time for self, right? And this could be 10 minutes, 5 minutes, could be 30 minutes. It could be that walk that you're having with your stroller buddy, but how do you get time for yourself to check in about your needs, right? And see, how did this week go? Right? Did I get that sleep? Did I get the nutrition? Did someone drop off that meal, or did they just come over and want to hold the baby? You know?
The worst. I'm sorry, that is just the worst. Melissa, did you want to maybe jump in about, the toolkit ahead of a birth?
Yeah, I mean, I think it really does align with what the doctor's been sharing, around not a postpartum plan, but postpartum goals. And that's what we work with families on. Or what are your goals? What are your feeding goals? What are your sleep goals? What are your attachment goals? And we identify that with the family prior to birth. And then we track them. I think it is important to do weekly check-ins. What is your progress towards your goal? Has your goal changed? It will. I think flexibility is incredibly important for mental health. In being able to, be flexible and realize that maybe your goal was to exclusively breastfeed and baby's not latching, or baby's allergic to, X, Y, and Z. And I think being flexible is going to help your mental health, and that needs to be on both sides of the partnership. We've seen many times where one of the partners is inflexible, and that causes a lot of strain and stress. So building that, the set of goals around some of those key pillars, and then checking in on them regularly. Protect your sleep, protect your sleep, protect your sleep. Absolutely. And then I think, mental health screening before baby arrives, and knowing exactly what you have access to. First of all, where are your risks before baby arrives, and then know what you have access to through your benefits. So review your benefits package, in your second trimester. Understand, is it, of course, it's mental health, but also massage therapy, acupuncture, all of these other, benefits that everyone has, or many people have access to.
Physiotherapy,
pelvic floor physio.
physiotherapy. Can we talk?
There's so many. I mean, you could go through that whole list, and almost everyone can positively impact your postpartum journey, throughout that first year. So I think knowing your benefits, understand that in your second trimester, get ahead of it, protect your sleep, and then of course your goals. Like, what are your goals for sleep and for feeding, primarily?
I would also add that, many birthing parents may stop their health benefits while they're on maternity leave. And so the importance of actually continuing those health benefits is a really important piece as well.
Yeah, and I think there's a general housekeeping around this that we focus a lot on with employers, where there's regular information being given to individuals on what they have. We're putting a lot of investment on the technology side. So if we know that you're planning to have a baby, let's serve you up so these are the things that are available to you. Please remember to tap into them should you need them. So sometimes we don't know, because we don't always know what every member is planning on doing, but when we do have that information, we are building technology to be able to serve up recommendations and information on what's available in your benefits package.
Is there also an opportunity where, there is a little bit of, workplace understanding around, if women are pregnant or on postpartum, that, they can actually work virtually, work from home, the flexibility as well to at least be able to give them that time before they come back?
Yes, absolutely. I think this is super critical to build flexibility and working with HR leaders on designing policies that really do make individuals feel supported and doing the best that they can, coming back part-time, taking your time, taking on more when you're ready, and not feeling some kind of pressure to go right back into the same schedule and remember all the things that you did, because you have a whole new responsibility here, and it's not as easy. But supporting that transition period is so critical. And all of our data shows that employers that do that well, they actually see much better outcomes than those who just provide leave, because leave itself is not good enough.
I've always talked about this ease back.
Yeah.
Right? It's why don't we have an ease back for after delivery? We have an ease back if there was a physical injury, if there was a broken arm, there's an OT involved to see, what can you do? How can we set up your place for you? So it's so exciting to hear about your ideas for that, because I think that transition period is creating that anxiety, not wanting to reach out and creating that fear when they get the call from employers, oh my gosh, I have to go back, childcare, what's happening? So, kind of having those conversations to know how we can support you, and this is what's available. That's great.
Yeah, it's a lot, right? Like when you're even again making that transition back to work and perhaps feeling that pressure to perform as you did. I remember covering, this is many years ago now, my eldest is 8, but Jane Philpott had left the federal cabinet, and I was going to go pick up my daughter Hazel at daycare, and I thought, there's some, this is a very different moment for me. This is a really big story. I normally would be jumping on it, and I have to go, so it just those moments perhaps that you realize that there's just going to be moments where your demands are going to be different professionally and personally. Before we pivot to the question and answer session, I'll just do a really quick, maybe if it's like a few words you want to offer each. What are you really hopeful about in this space? Perhaps, where would you like to see the conversation go?
I can start. I really think that, the time is now. It's probably a little too late, as we've discussed, but, a real call to action. As I've said, I think all stakeholders have a role to play here, whether it's healthcare professionals, and of course it starts with moms and families to talk about PPD, to be able to not have that social stigma, to increase that awareness, for physicians to be trained, and also to ensure that there is a system in place in terms of who is the one identifying that women are actually struggling, whether it's the lactation nurse or whether there's somebody else. And every province does it differently. Can we have a standardized practice that is a best practice as it relates to across the provinces? So that would really be my call to action.
We talk about this as a crisis, it is, but it's also an incredible opportunity. It's an incredible opportunity to change generational health outcomes. We want to see better communities and families. Let's start here. Let's start with the parent. Let's start with the infant mental health. Let's start now. Change the algorithm.
I think I'm most excited about all the innovation that's happening in this space, and entrepreneurs like yourselves that are building really amazing services, facilities, solutions for women. It's really good to see all the investment that's going into building that, and I'm excited to work with more companies to bring solutions to our members, and extremely excited about what's to come with our more in the women's health space. Lots to do, and really excited to see all the cool things.
And really along the same lines, like I think instead of addressing a crisis as this is a crisis, really being proactive in nature and building the infrastructure is what I'd love to see. Is let's just talk about solutions, let's build solutions. The time is now. That's what I'm most excited to take forward.
Thank you so much. Such a rich discussion. And we're going to pause now and open the floor to audience questions. So if you are joining us virtually, of course, please submit your questions through the Q&A box. And for those attending in person, you can just raise your hand and you can keep it raised until, yes, I love when people have questions. Yeah. And keep it raised until the mic is brought to you. So I'll go to the first question in the room.
Hello. Oh, am I on? Yes. Thank you so much. This was amazing. My name's Jillian, and I'm a senior product specialist at Medavie Blue Cross. And women's health is definitely on our priority list. A question I have for all of you is, I'm wondering if there's research either done or being done to track the experience of women who've experienced postpartum depression. What happens to them as they age? What happens when they start reaching their perimenopause phase? For example, is there a correlation between the hormonally induced stuff that goes on during postpartum, and is there a connection between what happens in the perimenopause phase? And yeah, are there long-term studies that speak to this, or will there be? Just trying to understand, there's the puberty, there's the postpartum, and then there's the perimenopause. And I'm wondering if there's any through story there.
Yes, the 3 Ps, as you mentioned, hormones. We're so blessed, aren't we? Just so lucky.
That's one way to put it, doctor. Like that optimism. Okay.
Oh man, the reality of it though, right? It's a lot, but you're right. There has been research, and there is more research coming around the hormonal variants that some individuals can have, that susceptibility around hormonal transitions, starting at premenstrual. Absolutely, and watching that, the premenstrual exacerbations and PMDDs that we see through women's lives that often are chalked up to you're bipolar, or you're have a personality issue. They're taking days off work. It's impactful, but there's a hormonal relationship there with mood that we are researching and understanding, which then leads to a risk factor for perinatal mood and anxiety disorders. Absolutely, in the large hormonal shifts that happen, and then perimenopause. Yay! So much to look forward to. But yeah, so there's another time of life of hormonal change, and there is a lot of research out there that actually says some women are reproductively more vulnerable if they've had previous experiences of experiencing that. Now, it's not always causation, right? Because you've had this, you're going to have that, but that's where that biopsychosocial approach comes in terms of management, conversations, treatments, what's worked, and knowing what your resources are. But there is a lot of research, yes, and more coming. Mm-hmm.
Thank you. And I'm going to turn it over just to a question from Mila with the Globe events team from our virtual audience.
One question that was asked was, as someone who had their children in the early 90s and was told to, quote, suck it up, what advice or language would you provide to support myself in supporting my daughter who is now having children?
There's so many
Melissa.
questions. I know. Sorry, I was just sitting in that because I'm
Yeah.
15 months postpartum. So I was like, that would have been my mom and me. I think just being supporting and, really, it sounds like you recognize that there was a significant gap in the advice and the resources that you were provided at that point in time. And I think it was a different time. And I think, you have access to so much now, both online through social media, which can be very positive, and leverage your resources. And you don't have to suck it up. Absolutely not. You're not in this alone. There are, so many professionals and people who have gone through the exact same thing as you, who are here to support you. You're in it together. We're all in it together. And there's so much more to be done than sucking it up.
Yeah, so don't suck it up.
Don't suck it up. Absolutely don't.
We'll go to another question in the room here. I know that we've had a hand up over. Do you have a question? Yes. And we'll go to you next.
Okay. I actually just wanted maybe description of the difference between postpartum depression and postpartum psychosis. I know we didn't touch on it, and it's such a wildly, there's a lot of people watching this, so I think it's really important to talk about that, like the spectrum and what you should do if you're experiencing postpartum psychosis.
Yeah, absolutely. So, a lot of unfortunate coverage will talk about they had depression and then they became psychotic. And the truth is there is very little correlation there. There's slight correlation, but that does not mean one becomes postpartum psychosis if they've had depression or anxiety symptoms. And that's really, really important to know, that it does not mean the same thing. Psychosis is incredibly important, an emergency situation that it can occur within a few days of delivery, but also there's research that it can also happen around the 3-month mark as well. So it's constantly monitoring and asking questions, but it's starting to have those delusions and hallucinations around those around you, around the baby, around your wellness, around loved ones. It's losing touch with that reality. That's really different than having persistent sadness and hopelessness and anxious feelings. A lot of crossover, don't get me wrong, and it can come out as different things, but it's persistent and acute and really needs urgent medical intervention and treatment. And again, that's where the knowledge of those around you and informing and talking about mental health, has there been a family history, are there risk factors, that sort of thing, that can help folks get the care that they need as urgently as possible, because it's a risk to themselves, it's a risk to the family members and children as well.
Yeah, just the mic's behind you.
Hi, thank you. So Melissa, you could be one of my children, because it's probably about almost going on 4 decades since I delivered. My name is Catherine, and I'm with Mental Health Research Canada. So you've talked about stress, anxiety, depression, and this is going from personal experience way back when. How does suicide ideation factor into this? Because, you talked about psychosis, but, if I look back, I had those moments, and I'm just wondering how prevalent it is, and, just what types of supports there are for people now that are experiencing that. Obviously, I'm here, so, but, no, and it wasn't probably like many people who experience it, but to say those moments didn't happen at that time, absolutely.
Huge. And I don't think we talk about this enough, and I'm just going to give my little sense on this. We talk about dark thoughts, right? Because they can be dark, they can be suicide, but there's also a lot of in between, right? What if, and I always give it to folks on a spectrum, because if you had a EPDS and there's a question about a screening question around thoughts of suicide, how are you going to answer that with a person in front of you that you might not know? So I always put it to a conversation around dark thoughts. On one hand, you can have, yes, suicide thoughts, plans, how I'm going to do this, what it's going to look like. You can also have thoughts in the middle. What if I wasn't here anymore, right? Who would look after the baby if I wasn't here? What would my partner do? What if I just didn't wake up and get out of bed today? And then you can have escape fantasies, right? So you can have these thoughts of just wanting to get away, get on a flight, get in the car, and just keep driving, check into a hotel, get some sleep. What does that escape feeling look like? So I always put it on a spectrum when it comes to suicide thoughts and dark thoughts, because it's important to keep an eye on all of those, right?
But we do know that suicide is, highly prevalent in postpartum depression, and I believe it's after 9 months where it's the highest risk, and one of the absolutely so.
Yeah, it's one of the leading causes actually of death in the first year after baby.
Thank you so much, everyone, for being here. All the panelists, on behalf of Globe Events, thank you for your valuable insights and for being here today. And Globe Events would also like to express thanks to Biogen for sponsoring today's event. We will be sending out a survey regarding the discussion here today, and we'd really appreciate if you could take a minute to fill it out. And for those of us joining virtually, a QR code will now be up that will allow for you to complete it, and a link to a recorded webcast will also be sent out to all the registered participants within the next couple of weeks. So thank you very much, everyone. It feels weird to pivot from talking about this to say, enjoy the rest of your day. So anyway, take good care, everyone. And for those who are joining us in person, please now feel free to join us for the following networking session. Take good care.
Thanks, Christy.